And on today's episode, we have Dr. Michael Hutchison. And I say he's a specialist in TMJ, and he'll tell you a little bit more about this. But he is a fantastic dentist, and we are going to dive into head trauma today. But before we get started, how are you today, sir?
I'm always good. We
Always
just make
good.
it happen.
That's a great answer. Do you care to elaborate a little bit more about your practice and, what you bring to this Get Trauma Informed movement?
Well, there's something called temporomandibular joint syndrome, or TMJ. People are familiar with that. The symptoms are migraine headaches, pain in the jaw, lethargic, just don't have energy. Pain drags you down, constant pain. Locked closed, so you can't open as wide as you normally can. And this is something that's been going on in our society for over 50 years with little help, little understanding. In fact, most of that time, and even so now, I'd say if you lined up 10 dentists, 9.5 would just say it's caused by stress. So knock your stress down. We can't cure it. The only thing we can do is give you a splint, and if it helps, it helps. If it doesn't, it doesn't, and there's nothing that can be done. And that is really absolutely not true. That is what they thought 50 years ago, and obviously 50 years later, we've learned a few things. It really has to do with how your teeth fit together in relation to your muscles. And if your teeth don't fit together the way the muscles function, then the muscles are the ones that suffer and radiate pain, and that's where the pain comes from. And this can be a problem that is elusive. Like, you have migraines and pain in the back of your eye or the back of your head, or you have neck pain, shoulder pain. You're just not going to go to the dentist. You're going to go to your primary care physician. And unfortunately, most of them don't really understand TMJ. It's not in their armamentarium or wheelhouse, if you will. And so usually they'll send you to an ENT. And this is very common among TMJ patients, that they see the ENT, they see the neurologist, they see the primary care, they see their dentist, and the dentist says there's nothing wrong with their teeth. I think most of us now as dentists can recognize TMJ, but there's not very many that can actually cure it. And this is what I do. And a lot of those cases have to have their teeth redone. And that's the other part of what my specialty is. I'm a cosmetic dentist. I was awarded accreditation in the Academy of Cosmetic Dentistry 24 years ago when it first started. And I was number 125 in the world. Now there's like 750. But we do your smile makeovers. We put your teeth back together, your jaw in the right place, all those kinds of things. And what brought me to you is the trauma of concussions, because it turns out that if your teeth aren't in the right place, it puts your brain in jeopardy when you receive a blow to your head. And the way you correct that is by putting your jaw in something called physiologic jaw position. And by doing that, it sends the forces of concussion away from your brain and can actually prevent a concussion from happening. So
Wow.
this is all kind of part of the science, and I'm here to talk to you about that type of trauma.
Wow, that's so interesting because a lot of us, like you said, we don't relate those, migraine headaches. And, I know several people that have the migraine headaches or that have and haven't been able to, find anything other than popping a pill daily for it and have no idea that it's related to, jaw issues. So before we go further into this conversation, I think you answered it pretty well, but what does get trauma informed mean to you?
I would say that the informed part of trauma informed is the really important thing. I think we all realize what the word trauma is. It's just a natural injury to some part of you. But the informed part is really the difficult part, because if you don't know what caused the trauma, then it's really difficult to treat that trauma. And especially in what we were just talking about, TMJ, when you have a migraine or a headache, we're all conditioned to kind of think logically. So, well, that's in my head, so it must be my brain, when really it's not your brain, it's the muscles that envelop your brain. Or neck pain, you must have done something to your neck. Not necessarily. And so the information is the most important part, because in this situation with TMJ, some of those muscles that are in your neck also connect to your jaw, and so that can throw things off. And if you're not informed as to what is actually happening that causes you your trouble, you will not be able to resolve it.
Wow, and see, this is a part of the self-care plan that we talk about in all the different forms of trauma. And we talk about awareness, getting in front of what the situation is. So putting together your own personal plan. So I think this is just a great conversation to have so that we can become aware and informed that, while you're putting together your self-care plan, you may want to set an appointment to come and see you. Because that may be part of, an amazing self-care plan. So just talking a little bit more about the head trauma, and you talked about the muscles, and I think we don't really like understand how our body is all connected, right? How all of the pieces fit together. When we were in elementary school, they talk about the head bones connected to the neck bone, and they talk about the neck bone and shoulder bone. So I think that's what you're really telling us, is that it's a little bit it bears to dig a little bit deeper when you're having these side effects, and especially when you go to the doctors and they're telling you it's nothing wrong. One of the cases that I'm actually going to send to you is a young lady that has had had migraine headaches, and basically they just fitted her with the apparatus for her mouth, and she still has the tension headaches, the pain, and everything. So I truly identify with that.
Yeah, I mean, I'll give you an analogy with that. Is that let's say you have one leg shorter than the other, and everybody's kind of familiar with a lift or an orthotic for their shoe to make things evened out and balanced. But if you don't measure what the imbalance is, and you just take out of the drawer, you know, couple pairs of socks and put them in your bottom of your boot, and it's not what you need, you're not going to get any resolution. You might even make it worse. And that's the thing we're talking about with TMJ, is that the state of the art 50 years ago, and when I was in dental school, they taught us that if somebody complained of TMJ symptoms, you make a splint. And how do you make a splint? You take impressions, you send it to a lab, say, I want a splint. The guy at the lab says, okay, I'll make this splint. This is how I make splints. And we bring it back and we give it to the patient and we say, okay, just wear this at night, because most people are clenching or grinding at night. And if it works, it works. If it doesn't, it doesn't. There's nothing we can do. And it is one of those arbitrary things where if a person needed the thickness of the splint that the lab guy chose to make, it might help them. But if they didn't need that much, then it would make them worse. Or if it wasn't enough, it wouldn't work. And so this is what's so important about, especially the trauma that comes from um, TMJ, the joint, is that this needs to be systematically measured and tested, and every person has a unique bite that needs to be addressed, and that's the important thing of this whole thing. Or you'll see all kinds of doctors, and you'll never get better. And even a dentist will make you this bite splint, and it may or may not work. And so you're just frustrated with, nobody's helping me, and I'm suffering this terrible pain. So definitely, uh, there's a resolution of that, and it can be cured. You just have to do it the right way.
I love that. I love that. I love bringing real solutions for, for trauma. So how has trauma empowered and inspired you, doctor?
Oh, it's changed my practice. Not from my own personal trauma, although I was a sufferer of TMJ, and I guess you would say that I might have been my first patient when I met a doctor who dedicated his whole career and practice in Seattle to solving this problem. He recognized that it was a problem that nobody knew how to fix. And like me, when I have a problem, if I can get to the source of the problem, the thing that's happening, I can fix it most of the time. But if I can't get to the real source of the problem, then it can't be fixed. And so this is what happened. I would just refer to him, and I talked to him, and he was a guy who only wanted to do TMJ. He just wanted to do that. And that's it. He didn't want to do fillings, crowns, anything. So he went to all the doctors in Seattle and said, "I want you to send me all your TMJ cases. I'll send them back to you. I'm not going to do their work. I just want to do their TMJ." And so that's what he did. And in some ways, he kind of experimented on people. He didn't hurt them, but he said, "I won't hurt you, but I'm going to try some things, and we're going to figure this out." And he certainly figured it out. And when I got to him, he taught. I went out to Las Vegas. I spent a weekend with him. I was having headaches. Um, Hotel rooms, I never slept very good because they're too dry and unfamiliar. And my wife's not there, so it's like sleeping by yourself,
Right.
familiar. And we started this little training, and I had a little appliance that we made. I went to the hotel, slept like a baby. My headaches went away, and I was just blown away with this. And I did it because I had 5 patients who really suffered a lot, and I didn't know how to help them. Nobody could help them. They came to me sort of out of desperation, and I wasn't anybody special, but except for there's 2 things about me: I don't quit, I don't give up, and I search for that cause. And so this caused me to search out what there was out there. And I came back after that weekend. I called all 5 of them up. I said, now I can cure your problem. And I did. All 5 of them are pain free now. And because of that, I became very, very ruthless when it came to curing people of TMJ. And ruthless is probably not the word, but I'd be out to dinner with my wife, and I'd overhear some woman say that she had migraines and it's just terrible and she can hardly do anything. And I would actually get up from the table as my wife said, "Sit back down, sit back down," and go over there and say, "I overheard you. I'm sorry. I didn't mean to eavesdrop, but I can help you. I can cure you. I can take care of that for you." And uh, I would always be able to do that because this is a true body mechanism. It's a true principle, and it's the way the body works, and it's the source of the problem. And so I'm not that aggressive anymore because I frankly have so many people coming from all over the United States. Uh, but I still uh, if I do hear over here sitting in a train or whatever, I always tell people, because I know what it's like to have your head exploding and nowhere to turn. It's no fun, and it really drags your life down. And so, um, this is to answer your question. This is what I know about that.
That's amazing. It just came to me too. And what popped in my head was a dentist with passion behind his practice, because you have such passion about, like you said, going out and being, I was going to say being resilient in your practice, but just being like, I need to find this answer because there's so many people that are suffering, and I call it suffering in silence when you're suffering in trauma and you may be searching for the answer and you just can't find it. But I'm so happy that you were able to, find the cure, find the where it was going to stop the pain, I should say, and I get passionate about it because trauma is a passion for me because of my own journey. So I totally relate to you when you talk about finding real solutions and not just putting a band-aid or, like you said, a sock in a shoe, right? Actually finding what actually works. You want to talk a little bit more about, what your answer is as far as the apparatus that you actually came up with?
Yeah. So when I was treating those 5 patients, my background, I came from a real sports family. My dad was an exercise physiologist, one of the first in the country. He got a job at Iowa State University, and we just attended every sport. He had free tickets, and we would just played every sport. My sister was a 3-time state champion gymnast, and I played football in high school, basketball, wrestled. Um, I joke that in Iowa, wrestling is a state law. You have to wrestle. So, um, what I would get back from these patients is not only would they feel like they had their pain was gone and they felt cured, but they would tell me, and this is something I didn't know about and was never taught, that they would report that they had more energy, that they were stronger. And some of the people would say, it's really weird because maybe it was a senior lady who's in maybe her 70s. She'd say, I have all these Christmas decorations in my basement and I used to could carry them up and I can't do it anymore. I have to have people help me. But now that you've eliminated my pain, I'm stronger. I can carry those boxes myself. And so I did some research and found that that was true. That was something that was kind of emerging, that if your jaw is out of position, it will put a brake on some of your nerve information to your muscles and cause you to be weaker in your overall muscle strength in your body. And so, what, of course, being a sports-minded person, I thought, well, gee, right now the Lions are 0-9, and if I made their front line stronger, they would uh, end up in the Super Bowl, and I would be a genius. And
See?
I would get to take my son to meet all these professional athletes, and he'd think I was a cool dad. So I started to figure out how do I extrapolate this into sports, and came up with a prototype. And just so happened that there was a person I didn't know yet here in Traverse City, but I just moved here, and he was the police chief and the fire chief, and his hobby was powerlifting, and he'd got on the USA powerlifting team in the 65-year-old category, and he won a national championship. He
Wow.
lifted 398 pounds on the bench press, and that was enough to win the national championship. And so, the course, since he was the police chief, fire chief, the local paper wrote an article about him. And in there it said he wanted to go to Prague, Czechoslovakia, and represent the United States and try to break the world record, which is more than he'd ever lifted in his life. It was 435 pounds, and the most he'd ever lifted was 398.
Wow.
So I called him up cold out of the phone book, and I said, I don't want you to think I'm a quack doctor, but I can get you the world record tonight. And of course, I said that out of faith because I'd never tested it. I just knew in my heart that it was true. It was a true principle. So I did, and he went, and that night he lifted 455 pounds and quit because he thought he was going to hurt himself. But he went on to Prague 6 weeks later and broke the world record and held it for 10 years at 435 pounds. And so I knew that I had discovered a body mechanism that was unknown, and I knew that at that point in time, it was just strength increase, which was later proven by Wayne State University. They showed a 16.8% increase in strength when your jaw is in your physiologic jaw position. So when I was testing my son's football teams and wrestling teams, none of the boys had a concussion for 6 years. And so that changed the whole game. And I moved into concussion reduction. And that's really kind of the emphasis that I have in this appliance that I call the NeuroGuard Plus. NeuroGuard because it works with your body's physiology and neurology to put your jaw in the right place. And when you receive a blow to the head, it can't go up to your brain. It gets dissipated because the joint is separated such that the energy can't pass that gap. So it has to go somewhere else. And we've shown a 0.2% concussion rate out of 7,000 people tested. That's 0.2%, almost zero. So in other words, there's a 99.8% chance that you won't get a concussion. And I think that's the missing link in concussion prevention. The helmets are good. Everything that they do is helpful, but everyone ignores the jaw, knows nothing about the jaw, and basically makes it worse by putting a chin strap on the helmets and pushing your jaw back up against the skull so it touches like a conduit. When you get hit, that G-force just like electricity just takes it right up to the brain. So I think this is the missing link, and that's why I'm super passionate. That's why I contacted you, because every mother, every father, every coach, and every athlete should know that there is an answer to concussion prevention, and they can keep themselves safe. Because I have a friend whose son was a student. He was a scholar athlete. He was the talk of the party. Everybody loved him, and he got a concussion, and he turned into a juvenile, basically a juvenile delinquent. He wouldn't go to school. He got D's and F's. He got in trouble with the law. He just turned 180 degrees and still struggles because of one traumatic brain injury. And if he would have had this technology, and his father is so passionate about down in Texas, he's my number one advocate because of that. And he did lose a daughter, not in a sports accident, but she got a head trauma and died. So he's very, very passionate about this. And this is something that you can do right now, this very second, that will protect you and help you play better. And you don't have to do hardly anything to do it, and it doesn't cost very much money. So it's really something so important for everyone who's listening. They need to go on to neuroguardplus.com and order one, because this is the only thing out there that can do this so far. It's the only thing, and everything else out there is directed towards treatments, not prevention. And this is something that you can do right now for every one of your kids.
Thank you so very much for that and the awareness point. And that's what we're doing in the Get Trauma Informed movement, is to bring awareness around the different types of trauma. And I applaud you for the work that you're doing. And we're going to do everything that we can in the Get Trauma Informed movement to push for more awareness and for them to be in contact with you. So as we wrap up in our last few minutes here, what would you say? And I think you've already said it, I'm just officially asking the question. What would you say to someone faced with trauma? And I think that would be to go into neuroguardplus.com and order your NeuroGuard. But is there any final words that you'd like to leave our audience with today?
Well, obviously, that's my home thing. And definitely, that's one thing you can do right now. Just, I mean, it'll come to you in 3 days, and get it on your kid. And even adults who do recreational sports, hockey, people who ride their bike. I got a guy who mows his lawn with it. Just it touches everyone, because so does concussions. And I don't think there's a family out there that hasn't had trauma from a concussion, whether it be themselves or a sister, a brother, a son, a daughter, mother, father, whatever. Every family's had concussions, and it's not fun, and it's a lifelong debilitating problem. And so definitely that, but also getting back to the fundamental thing we talked about at the beginning. Get to the source of the problem. And if you don't feel right about what you're being told, trust your heart. And we have so much easier ability now to get more information, and never give up, because usually we can get to the source of the problem. There are some things that cannot be fixed, even if you get to the source of the problem, but most things you can. And this is one of them. And most trauma can be repaired in such a way that you can live a better life. But when it comes to concussions, if you don't have this technology, you are rolling the dice, and there's just no need. It's just senseless to go out there on the field. And not only talking about football and lacrosse and obvious contact sports, but women have a twice the chance of getting a concussion because of their neck structure. And women need this technology more than anything. And it touches all their sports, from cheerleading to softball to basketball. These are the top concussion sports that women have to face. The number one is soccer, and I don't think many kids wear a mouth guard in soccer. So again, the NeuroGuard Plus is a medical safety device. It's not necessarily a mouth guard, although it does keep your teeth from banging together and breaking, just like a regular mouth guard was designed for. But it does more. It does more, and it helps you keep yourself safe and keep yourself away from a really traumatic injury like a concussion.
Dr. Hutchinson, I thank you so much. And I have 9 grandchildren, and they're all active in sports. So we definitely are jumping aboard, because we want to make sure that we keep them safe on the field. So I thank you so much for spending your valuable, precious time with us today and giving us more information on how we can be safe and how we can move forward safely in our sports and being active. So again, thank you so much. And we'll make sure that we put your information in the show notes so that people can get in contact with you. Again, thank you so very much. We appreciate you today.
I'm grateful to you for doing this. I know that you have lots of people who trust in you, and it's been a privilege, and I really appreciate it. And you have a great weekend.
You as well. Thank you.